My name's Sandeep Dhallu, and today I'm going to talk to you a little bit about the importance of nutrition on ocular health. So I'll make a start. So as we know, diet and nutrition is important for good overall health. This webinar will provide an overview on the effect of nutrition on ocular health. We'll talk about the use of nutritional supplements and also the role of optometrists in providing nutritional advice to our patients. So let's start just by having a look more generally at food and how much of it we should be eating. So the food that we eat provides our body with the energy and essential nutrients it needs. So food can be categorized into three groups. So carbohydrates, proteins and fats. Carbohydrates play an important role. They're an important source of energy and they fuel important processes within the body. As most of us probably know, proteins are needed for growth and repair, and they're also a good source of vitamins and minerals as well. And finally, so vitamins and minerals including things like iron, zinc and B vitamins. So proteins are essential for that. And then we've got the third group, which are the fats and the sugar, and they're sources of energy, and they must be consumed in moderation. So food also contains essential micronutrients, such as vitamins and minerals, and these generally cannot be synthesized in the body, and so they need to be obtained from our diet. Micronutrients are vital to health and well-being, and also in disease prevention. So in general, people only need a small amount of micronutrients, but it's important that the recommended amount is consumed, because if you're deficient, that can have consequences on health. So for example, iron, it's important for motor and cognitive development. You've got vitamin A, which helps to support a healthy immune system, and vitamin D is an example as well, and that's needed to build strong bones and again help the immune system to resist bacteria and viruses, which is particularly pertinent in the current circumstances. So micronutrients are essential. As most of you have probably seen, this is the Eat Well Guide, which was published by Public Health England, and it outlines what and how much we should be consuming each day for a healthy and balanced diet. So starchy foods like bread, pasta and rice should make up around a third of what we eat. And it's recommended that we try and eat around 5 portions of fruit and veg a day because they're good sources of vitamins and minerals. So most of us have probably seen this in some sort of format and know that this is generally how much we should be eating. Most people are aware that a balanced diet is needed for good overall health, but there's generally less awareness amongst the population about the link between good nutrition and some ocular conditions, and that forms the basis of this afternoon's webinar. So what ocular conditions are we talking about? So there's research to show that the following ocular conditions may be influenced by diet, and we'll go through each of these in turn, starting with AMD. So age-related macular degeneration. There's research to show that the antioxidant vitamins A, which our bodies convert from beta-carotene in our diets, as well as the antioxidant vitamins C and E, the trace element zinc and micronutrients such as lutein and zeaxanthin are thought to be helpful in AMD because of the free radical theory of cell damage. So antioxidants are thought to help counteract free radicals, thereby delaying or preventing the damaging effect that they have on cells. So there were 2 age-related eye disease studies, AREDS 1 and AREDS 2, that have explored the role of these antioxidants in slowing down the progression of AMD in people that have already been diagnosed with the condition. And what they found was that for some people with AMD, taking an antioxidant formula did slow down the progression. So just go back. Altacore, who are sponsoring this webinar today, have a supplement called VisuBright, which is available to buy and includes all of the aforementioned micronutrients. There are other supplements as well, such as MacuShield Gold, and this includes a slightly different formulation. It includes lutein, zeaxanthin, zinc, copper, and vitamin C and E. So it's slightly different to the VisuBright, but the VisuBright has all of the ingredients mentioned on the previous slide. So these supplements are readily available to us, and we can recommend that to our patients. The next condition will be cataract. So as the crystalline lens ages, there's a progressive loss in transparency and an associated loss in vision. So oxidation reactions within the lens are thought to play a role in this, and there are some studies that have shown that a healthy diet that's rich in antioxidant containing foods may actually decrease the risk of developing cataracts. There are also suggestions that taking some vitamins and minerals may also have a protective effect on the development of cataracts as well. However, research is equivocal at the moment, with some studies suggesting that the risk of cataracts can be reduced by a diet that contains optimal levels of vitamins C and E, as well as the carotenoids, lutein and zeaxanthin, and also daily use multivitamin supplements. So there was a research article by Eyecare et al. In 2014, which found a beneficial effect with taking these supplements and progression of cataract. So some studies have found that there is a benefit, whereas others have found that this is not the case. So a randomized control trial that compared antioxidant vitamin supplements, which contain beta carotene and vitamin C and E, with an inactive placebo, found that there was no effect on the incidence or progression of cataract, and that was a study by Matthew et al. In 2014. So further research may be needed in order to explore whether it's a particular combination of antioxidants that's needed, or if they just need to be taken over a longer time period in order to produce an effect. So there's some indication that they may be beneficial, but I think further research is needed just in order to explore the longer term benefits of taking these supplements. Interestingly, the ARID study, which we touched on earlier, also found that the use of multivitamins did actually reduce the risk of developing nuclear cataracts over an approximate 10-year follow-up period. So there may be some benefit to multivitamin supplementation with it for cataract, but further research and longer term research is needed in that area. So the next disease condition is dry eye. So as we know, dry eye is a multifactorial disease of the ocular surface, and it's characterized by things like tear film instability, inflammation, tear hyperosmolarity, and also epithelial damage. So more recently, therapies that target inflammation and oxidative stress are being looked into as a potential therapy for dry eye sufferers as well. There's an increasing body of evidence that supports the possible role of different micronutrients for the treatment of ocular surface disease. So Pellegrini et al. Have been researching this, and they produced a paper just last year on this. So there's a potential for micronutrients to help in dry eye progression. As most of us know, clinical trials that have looked into omega-3 have shown a positive effect on dry eye symptoms when they're taken in particular quantities. So omega-3 fatty acid, it's thought to play a role in the maintenance of tear stability, but not tear production. And this is done by altering the meibomian gland secretions and meibum quality in patients that are suffering from meibomian gland disease and chronic blepharitis. And it's thought that it helps to produce a more stable tear film and then therefore reducing the signs and symptoms of dry eye. So most of us already know about the benefits of omega-3, and no doubt we already recommend this to our patients. More recently, it's been suggested that preformed GLA, which can be found in green leafy vegetables, nuts, and vegetable oils, may also help to prevent dry eye symptoms. And again, that's part of a research study that was conducted and published last year. So new therapies are continually being looked at, but there may be a benefit to certain diet changes and increasing intake of green leafy veg and nuts on dry eye signs and symptoms. So that might be worth letting patients know about as well. The next disease condition is glaucoma. So as we know, glaucoma is recognized as a group of complex conditions that ultimately lead to optic nerve damage. So as with the other conditions that we've talked about so far, oxidative stress is believed to play a role in the pathogenesis of primary open-angle glaucoma. So this was a finding from 2007. There's evidence to suggest that patients with primary open-angle glaucoma have an increased oxidative status, and therefore antioxidants are thought to play a role in reducing the effect of oxidative damage. So there's a possibility that nutritional supplements with antioxidant properties could be beneficial, and this is something that should and is being explored. It might be pertinent to consider the use of nutritional supplements alongside conventional treatment as a way to slow down the progression or help reduce the risk of glaucoma. So we use in conjunction with existing treatment rather than instead of in the case of glaucoma. So vitamin C, which we can't produce by ourselves, has to be taken in through diet. So it should be an essential part of our diet. It has many functions, and this includes the role of an antioxidant. So the effects of vitamin C on intraocular pressure were investigated in a group of patients with ocular hypertension. So this was a study that was conducted quite a while ago in 1969 by Lena, and they investigated the administration of oral and topical vitamin C in patients with ocular hypertension. And they found that in the group that were taking vitamin C orally, there was an average reduction in pressure of 1.10 millimeters of mercury. While in the group that were taking vitamin C by topical application, there was an average reduction in pressure of 1.19 millimeters per mercury. They sort of hypothesized that this occurred because of a reduction in the rate of aqueous flow, or possibly by bulk drainage via the posterior uveoscleral pathway. So they found beneficial effects in vitamin C application. There were several limitations of this particular study. However, more generally, there is evidence to support the role of vitamin C in controlling intraocular pressure. So that's certainly something that is being and has been looked into previously. Having said that, it's been reported that just lowering intraocular pressure alone may not actually be enough to control disease progression within glaucoma. So despite reducing the intraocular pressure, nearly 42% of patients suffering from glaucoma will still become blind in one eye, and around 16% in both eyes during their lifetime. So reducing IOP alone is not thought to help completely control this condition. And as such, there is a focus towards non-IOP lowering therapies as well. And one such example is the naturally occurring compound that's known as coenzyme Q. So CoQ. You might have seen this in shops and health stores. This is thought to act as a neuroprotectant in glaucoma patients. It's been suggested that DNA damage and lipid peroxidation as a result of oxidative stress can be prevented by coenzyme Q10. So there's some potential benefit of that particular supplement in potentially limiting oxidation-related damage. In addition, there's also some research that shows omega-3 fatty acids such as polyunsaturated fatty acid and DHA, which also have antioxidant properties. There's limited research into the use of omega-3 fatty acids in glaucoma treatment specifically, but more generally it's known that fatty acids have the ability to lower free radicals, and so there might be some benefit in omega-3 fatty acids for glaucoma patients as well. Next up, Ginka, ginkgo biloba extract. So you might have heard of this. It's from the ginkgo tree and it's commonly used in China. It contains over 60 known bioactive compounds, including flavonoids and antioxidants. So in 1999, Chung and colleagues investigated the effect of GBE on ocular blood flow velocity. They found no effect on intraocular pressure, but they found that taking this supplement increased ocular blood flow. This therefore holds promise as a therapeutic supplement, since reduced ocular blood flow is a factor that's thought to be linked with glaucomatous progression. So there might be some benefit with this particular supplement for some glaucoma patients, which I thought was an interesting addition to this. So far we've predominantly talked about food up until now, so it would also be worth touching briefly on the effect of drinks as well. There have been studies which have looked at the association of commonly consumed beverages with glaucoma, and they've reported equivocal effects, and it's suggested that the effects can be different among different ethnicities, but I thought it'd still be worth touching on that today. So there was a study by a group of Korean researchers investigating the link between alcohol consumption and intraocular pressure. And they found that alcohol consumption more than twice a week was associated with an increased intraocular pressure in men who hadn't been diagnosed with primary open-angle glaucoma. They also found that there's a link in women that had been diagnosed with primary open-angle glaucoma who drank more than 4 times a week. So there was found to be a link between alcohol consumption and POAG risk, but there was a difference within the different genders. Similarly, there was research done looking into the effect of consuming coffee, tea and soft drinks and the risk of open-angle glaucoma. Again, this was done on a Korean population, and what they found was that there was an association between coffee consumption and open-angle glaucoma, particularly in men. They found no association with tea or soft drinks, so it was just the coffee consumption in that study. This is in keeping with the findings of a study from the UK Biobank, which also found that those with the strongest genetic predisposition to elevated intraocular pressure had, in those patients, greater coffee consumption was associated with higher IOP. So those that had a genetic predisposition to having higher IOPs were more likely to suffer with high IOP if they had a higher coffee consumption. And there was also a higher prevalence of glaucoma in those patients as well. So it might be pertinent for patients who perhaps are more predisposed to raised IOP or who perhaps need to control their IOP to consider their alcohol and coffee consumption. Research is still ongoing in this area and the research studies are fairly recent, so research is currently being conducted into this, but it might be worth bearing that in mind as an advice point to patients potentially. that brings us on to the end of the more commonly seen conditions in practice. The final few conditions are slightly rarer, but we'll still discuss those because there are certain links to nutrition and nutritional supplements. So the next condition will be retinitis pigmentosa. So RP, as it's more commonly known, is the name given to a diverse group of inherited eye disorders. They affect the retinal cells. So it's been suggested that vitamin A may have a beneficial effect for people with RP. There were limitations to the research study, but and the positive effects were very, very slight, but there has been shown to be a slight benefit to RP sufferers with vitamin A supplementation. There are other studies that are looking at the effect of antioxidant supplements again for this condition as well, but research into that is ongoing. The next set of conditions are cone rod dystrophies and Stargardt's disease. So cone rod dystrophies and Stargardt's disease are also genetic conditions, and they also affect the retina, the cells of the retina. Unlike with retinitis pigmentosa, there is evidence that taking large amounts of vitamin A can potentially speed up vision loss and retinal degeneration in those with recessive Stargardt's disease, cone rod dystrophy, or any other retinal condition which is caused by variations in the ABCA4 gene. So unlike with retinitis pigmentosa, in these conditions, vitamin A can actually be worse and affect vision negatively. So in patients with these conditions, it would be beneficial for them to avoid taking supplements which may contain vitamin A. Okay, and then last but not least, nutritional optic neuropathy. So nutritional optic neuropathy is probably not one that is commonly seen in developed countries. It's caused by malabsorption from drugs or just from a poor diet as well. So you may have heard rare stories of patients with a very, very poor diet that then developed this condition, but it is fairly rare, especially in developed countries. It's usually caused by deficiency in the B vitamins, so B1, B2, B3, B6, B9, B12, and also copper. So these are known factors that might give rise to this neuropathy. So supplementation with the B vitamins especially might be worth considering for particular patients.
What we'll do as well.
So far we've discussed what constitutes a good diet and how this can affect certain ocular conditions. The next question to consider is how much should we consume? So there are numerous recommendations on the amount and type of food we should consume as evidenced by the Eat Well guide. So there's a lot of information out there, but what we must remember is that nutritional requirements can vary between individuals, and nutrients that can be obtained from a food source are determined by the bioavailability and absorption as well. So there are factors which might affect how well a patient can absorb nutrients and minerals from their food. So factors that can affect this ability to absorb minerals and vitamins include things like a patient's age. It generally decreases over time. Their nutritional status as well, and certain systemic diseases, so cystic fibrosis, ulcerative colitis. These sorts of conditions can cause malabsorption as well. And so different people have different needs and requirements from their diet because of factors such as this. And this brings us on to nutritional supplements. So nutritional supplements are concentrated sources of vitamins, minerals, and other substances, which can have a physiological or nutritional effect. So there are certain groups of people, like very young children, individuals that have deficiencies, women during pregnancy, older populations as well, who may need to rely on the use of these supplements for various factors and reasons. So in general, supplementation should be in addition to and not a substitute for a healthy, balanced diet. So we should always recommend patients to try and get their nutrition from food, but in some cases that may need to be supported with the use of nutritional supplements. As with medical drugs, herbal medicines and these supplements can cause ocular side effects, and so they need to be taken with care and in conjunction with the GP. Patients need to check with their GP first before they start taking any nutritional supplements, just in case there's an effect with any other drugs that they might be taking for any other conditions. So it's always worth asking your patients to just check with the GP first before they start taking any supplements. So who is best placed to give advice on diet? So generally GPs, if they want patients to receive specialist dietary advice, they usually refer them on to dietitians, and dietitians are sort of trained to advise patients on diet and nutrition. However, there are other professionals, including optometrists, who would be well placed to provide nutritional advice to the general public. So, as mentioned earlier, there's less awareness within the wider population of the link between a good diet and good ocular health. While many people are aware of the link between a poor diet and things like obesity, heart disease, type 2 diabetes, they're generally less conscious of the role that nutrition can play in supporting their eye health. Optometrists would be well placed to highlight this link between a good diet and ocular health, primarily because, pandemic aside, we see patients quite regularly for routine checkups, whereas GPs and others only see them when there's a problem. Patients only go to a GP if they're suffering with something. They only get referred to a dietitian if there's a problem, whereas optometrists are generally see patients routinely, just as part of their routine ocular health checks. So we potentially are better placed to provide this sort of advice to patients and preempt any sort of deficiencies or problems occurring. So we can give that information to patients potentially at an earlier point, which might be more beneficial to them before any sort of problems develop. So I think as optometrists, we should be proactive in discussing the effect of diet and nutrition with patients where relevant. For example, advising eye drops to a patient with dry eye disease is easy enough, but giving them perhaps a more comprehensive approach that includes dietary advice as well might be more beneficial for the patient in the long run, and just give them a more holistic sort of treatment for their ocular condition. So I think as optometrists, we need to, we're well placed for that, and we should be mindful of giving this advice to patients where we can. So in conclusion, most people are not overly aware of the connection between nutrition and eye health, and we're well placed to provide this advice with a view to it being used in conjunction with other treatment therapies, so just to help support their well-being in conjunction with rather than instead of. And that's it. Thank you for your attention, and I've got my list of references there if anyone's interested in reading up on those research studies in more detail. And I'd like to